Hello. I really wish that I knew how to do a YouTube video. I'm quite proficient in TikTok, but we're going to get through the YouTube video. Okay, so this is my outline on my paper that was entitled Educational Needs of U.S. Emergency Nurses Related to Forensic Nursing Process. So this was a study about nurses in the U.S. who work in ED and even sometimes the OB and other areas where you need to be able to identify a victim of abuse, neglect, or violence. And so they only reached out to the what is it called? The basically Emergency Nurse Association. So I really do not believe that a lot of the possible OB nurses or any other kind of nurse who is not part of this group had access to our to their survey. And so while they're talking throughout this paper, like, oh, well, we have these nurses involved as well, this is a possible area where they could be found, they were not at all included. So I'm going to go ahead and go through my outline. So we had some goals of this study. The goals were to identify long-term physical and psychological as well as economic consequences of violence, of injury and death. And they were to investigate how confident ED nurses feel about their skills and recognize that patients are being subjected to abuse, neglect, or violence. Obviously, if someone comes in with a gunshot, they're going to be a victim of violence. But sometimes some of these other aspects of care, you don't really think, oh, that person is a victim. So I don't know if anyone else watches it. I do occasionally watch the clips. It's on my to-do list. It's a watch list after nursing school, of course. Is going to be like Nurse Jackie. And I saw a clip where she actually identified a elder's caregiver who was abusing her. Hadn't had their nails clipped in weeks, months, maybe even smells terrible. But this person was being paid to take care of this older woman, and she obviously wasn't. She was collecting a check, and then she was not checking on this woman, not buying her food, things of that nature. And so I know that, they wouldn't actually starve an older person for a TV show, but, that was kind of implied. Like, she didn't bring her groceries, she didn't take care of her like she should. And how often do we encounter things like that we don't see? You don't see it because you don't know what you're looking for. So that's two of their goals. Summary, they have a brief background. Further data and evidence are necessary to address this high priority public health issue. The sampling was microscopic, and we need to really get out there and figure out how to reach nurses, how to get nurses to respond, so that we know more about this issue. ED nurses continue to encounter patients who suffer traumatic injury or death, and many lack sufficient training to identify, collect, and preserve evidence and document for illegal use. If you were to tell me, Sammy, collect this for the police, I would have no idea how to do that. Because we're not just talking about, oh, yeah, there were some bruises. No, we're talking about rape kits. If someone handed you a rape kit, would you know what to do with it? No, I don't either. That's why we need more training. ED nurses are not routinely trained to be able to handle patients of violent offenses. Again, you're coming to somebody who has no training in how to deal with someone who has PTSD. Often we think, oh, they're being violent, let's get security in here and let's have them tackle them. Not always the case necessary. We don't always want the person who was just, maybe beat up by a big man, a woman. We don't want security coming in and she's saying, oh, they're going to beat me up. Now she's going to go crazy. Only 6 states in the U.S. have mandated training for ED nurses to get forensic nurse training. 6. Last time I checked, there were 50 states. That is a huge number of states that do not have any requirements. That's sad. Evidence suggestion training improves recognition of patients who are experiencing human trafficking. Oh my gosh, did we think about that? Did we think about the little kids who were getting picked up and kidnapped, sold into slavery? No, we didn't. So there's a whole other aspect. I would, unless it was like one of those TV shows where the kids slipped you a little note, would I be able to tell? Probably not. Specialty practice APRN, so advanced practice nurses, receive training. However, little to no training is given in the undergraduate area, and that includes ADN, like us. Research done outside the U.S., oh my gosh, look at that, suggests a benefit in incorporating undergrad education. So somebody else, didn't say where, France, Europe, Asia, did not say that there is a benefit in getting undergraduate nurses, the majority of your nurses, training. Why is it necessary to conduct this research, you might ask? There's a potential for trauma in every patient we encounter. You do not go home with these people. You do not know where they're from. You do not know their backgrounds. They could be living in an upscale mansion, and they could have come from the slums in a lower income area. We do not know, and we do not know what their pasts have been like. There is to responsibly integrate knowledge into practice so as to not re-traumatize the patient with our actions and words. I am a big loudmouth person. We all know this. Do I say things and put my foot in my mouth sometimes? Yes, absolutely. And guess what? Sometimes I have to be careful because I don't know what I'm saying, if that could offend or hurt or traumatize a person. We have a documented need for more education to improve care of patients in the ED in the United States of America. And no known level of knowledge or skills and training for ED nurses is available in the U.S. So no known level of knowledge and skill and training for ED nurses in the U.S. So methods used for this survey, they did a quantitative exploratory approach, and I don't like the method that they used. They gave a limited number of questions, they emailed it out, they had no incentive for people to respond, so they got a very low response rate. Very, very minute. So let's talk about that. So they did an email cross-sectional survey that was sent to a convenient sample of U.S. ED nurses that were part of the Emergency Nurse Association. Okay, so only if you were part of this nurse association and on their email list could you receive this survey. They sent out 43,775 emails. Of that, 2,493 opened. Almost 44,000 sent, less than 3,000 opened, and only 1,824 responses. That's 4% of the entire mass email sent that responded. And of that, that's like 73% response rate. Out of the 2,493 that opened, it's like a 73% response rate. Oh, you think, oh yeah, 73%, that could look really great. But whenever you're talking about the actual number of people who responded, it's nothing. It's peas and carrots. Okay, so they use descriptive analysis to measure, and their step-by-step descriptions were conducted over 8 weeks, October 1st to November 30th of 2020. Again, this is 2020. We were all in a really bad place. I don't care if you were in nursing, healthcare, or not. Everybody was in a bad place in October through November of 2020. Okay, so they used this previous study that was sent to Korean nurses, and they just revamped it and used it for this ED research. Okay, so they had 26 questions, 26 items. There was 14 questions about their nurse facility demographics, and 12 about forensic nursing. And this was like a question, and it was like, let me give you an example. So like they were asking, hold on, I have to look at this because I can never remember how they word this. Rarely, occasionally, frequently, or the other type of answer was the nurse could answer rarely, frequently, occasionally, and slightly competent, moderately competent, and extremely competent. Those were the only ways that they could measure, and it was the nurse's own judgment of themselves. Okay, so they had 10 consulting experts for emergency nursing, and then 2 experts in forensic nursing. The sample of nurses were over 18, English speakers, and worked in U.S. emergency departments. And they did break it down to include, like, were they rural, suburban, urban, and a few things of that nature. They did break that down. Analysis was downloaded, and then they just did a descriptive analysis to break down all these questions, put the data together, and it was very basic. They did not do a whole lot with it. They put it in charts. Right. Research results findings. So a large gap became apparent between a need for competency in forensic nursing and the overall capacity to provide specialty care to patients. Basically, all that means is that we do not have enough nurses trained to be able to take care of the number of patients who need somebody with specialty training. The conclusion, there's an unmet need for education and competency training for forensic nurses and US EDs. We need to get training set up with our hospitals. That goes into my personal thoughts. Hospitals have got to start offering training and promoting it, requiring it. If you were a chemotherapy nurse, you would be required to be nationally certified and competent to administer chemo so that you're not going to hurt yourself or your other patients or even your coworkers. So why are we not requiring training for ED nurses? In here it said that there is a higher chance, like a higher likelihood of a person becoming more sympathetic to victims with this training. I know that we get very out there with our thoughts and we go, oh, who cares? But I think that this is important. We need to remember that these are humans that we're dealing with every day. So hospitals should not rely on a handful of nurses who are trained for SAFE or SANE certified. Those are the certifications you can get in the U.S. We have weakness of a small percentage of respondents. Like I said, there was only a 4% response rate. And questions were asked subjectively and had no measurable comparison beyond the nurse self-reporting on herself or himself. So I believe I am competent. I don't believe I'm competent. It's basically what these nurses were saying. There was no way to measure that. I don't know if there is, but this did not give them an option to measure. Questions were, so research needs to be duplicated with a lot more responses. They mentioned the OB and a couple other areas. I think that definitely needs to be reached out to. OB nurses, maybe do this survey again and see if you would get a greater response. Use several associations. Use advertising. Offer it at nurse conventions where you're going to have a lot of people. Send it out, QR codes, whatever we need to do to get this survey out there and have people responding to it. Thank you.